So we're having a workshop actually on this in a couple of months, but would you please comment on the use of CBT in addiction counseling?
Yeah, I think probably to save time, how many people work with addictions? And yeah, there's a lot. We just came out with a book by Guilford. Amy Wenzel was the author, was the chief author, and I was next to the last author, but it was based on an earlier book that I wrote on addictions. So there's an earlier book that I wrote, but the more recent book is Group Therapy for Addiction Counselors, Cognitive Group Therapy for Addiction Counselors, and it just came out, and I think it might be best to save time if I refer you to that, but I can tell you a couple of techniques anyhow, since the question was raised. I don't know how many of you do kind of in-office desensitization, say, to cocaine. Okay, so one of the things that we've done is we would bring out the paraphernalia and the white powder and so on right into the office, but not the real cocaine, just simulate it. So you simulate the situation that's likely to occur in the outside world. So you simulate it, and when you simulate it, it now arouses all of the craving and all the things that go with it. And then you can train the patient at that particular point on handling the craving. So there's a whole sequence. I don't know if you've read my earlier book, but there's a sequence. There's first of all, there's a stimulus situation, which may be the person's feeling bad, or somebody says, let's go get a hit together, or you're feeling good and you feel you want to celebrate and so on. So that's kind of the stimulus situation. And then comes the craving. And after the craving comes giving yourself permission. And you say it's okay, and it's true of all the addictions, that's the giving yourself permission. And then after that are the instrumental acts. And each one of these facets can be interrupted at that phase. And so what we do in the office is we go through each of these phases and give the patients tools to be able to interrupt at each of the segments of the phase. And that's about as much, and for the rest you'll have to read the book.